Hey guys, today I wanted to talk to you about my medications. I'm taking 19 different medications for my gastroparesis. Some for pain, some for nausea, anxiety, depression, motility is very important. My gastroparesis is non-diabetic. It's very severe. I only have activity in my small intestine. So my stomach nerves are not working at all, and neither are the colon, like the large bowel isn't working either. So they put a pacemaker in for my small intestine, and they also put in a feeding tube, and I also have a Hickman catheter in my chest, which goes to the artery near my heart. For some of the IV medications that I'm on. So I kind of have to juggle this, and it's really hard, especially when you're sick, especially when you're not in your right mind from side effects, which is a really scary time. So I just wanted to kind of talk to you about the medication that I'm on, and if there was any trouble with any, I think you should know. So here we go. Okay, so see this book right here. This book, I write down when I take my medicine and all that, and it helps because I don't remember, okay? I've got my TENS unit here. Hold on. Okay, so this is all of my pain medication, okay? Here we have the Dilaudid, Percocet, Lyrica, Selma, morphine, the lidocaine patches, the TENS unit. I also have somebody who comes and does like massages for me and stuff, and that helps a lot. So that's for the pain. As far as those medications go, the Lidoderm patch is freezing cold. Okay, so just beware of that. The Percocet, the Dilaudid, and the morphine are obviously narcotic, and that slows motility, and that is not good for someone with gastroparesis. So I take as little as I can, but that's still quite a bit. So I'm working on that. I think my favorite is the Selma. The only thing is it makes my mouth a little numb in the beginning, but it works really good for the kind of pain that I have from my gastroparesis. The morphine I only use like very rarely, and the TENS unit really does help. You should read into that because it's non, you don't have to take any drugs. It doesn't hurt or anything like that. Another thing that I just got done for my pain is I got a nerve block. They did an endoscopy, and they went into the plexus of the nerves that control your gut. They did a nerve block on those to help me not feel pain, and that was about 3 weeks ago, and it's helping, but for some reason my body keeps rejecting these feeding tubes, so I gotta figure that out. Right now I have a Mickey feeding tube, and that's much better than the other one I had, so that's good. Another thing that's important is here. What I have here, this is my emergency epinephrine, okay? I have these, and I have notes on how to use them around, because here's another one. I think it's a good idea to plan for the worst, but hope for the best, so that's kind of why I do that. Okay, so the next medication I'm moving on to is for motility, okay? See, there we go, motility. Okay, so this one, I just started the Bethanacol chloride, and it's fine, whatever. But the Mestinin here, that works. Mestinin works. I don't really have bad side effects to those, but I have been using magnesium citrate because they haven't been working that well. The next one is for anxiety and depression, and here we have the Buspirine and the lorazepam or Ativan, which are both great. I love both of those, especially the lorazepam. It helps with my pain. It helps me with my emotions and everything. I like, and I am not endorsed, I wish I was, but I'm not, you know, working with Cindy Crawford, but I've been using her Cindy Crawford Meaningful Beauty Wellness Complete Beauty Complex Vitamin right here. And it makes me have so much more energy and feel so much better. So you might want to try that. You can get it online. This is the sertraline for the depression, so that's good. If I stop doing that, I'm in trouble. As far as side effects, these are all great medications to me. Okay, now we're going to move on to the feeding tube medications. So this is what prompted me to do the video. This medicine is terrible. This is called granitosol, and it is usually used for cancer patients. I had my first dose. I'm supposed to do 5 milliliters, which is 1 teaspoon every 12 hours. After my second dose, I couldn't walk. My speech was slurred. I couldn't do my medicine. I had to call on my mother-in-law to come take care of me, and I kept falling. I mean, I fell like 40 times. The you know, the pamphlet that comes with it, my mother-in-law was reading it, and I guess that those are all common side effects, and I just have to keep taking the medicine and hoping that, you know, I get used to it and that doesn't happen again, because it was so scary and so terrible. I was saying things that didn't make sense. I didn't know what was going on. It was like, I don't even know. I don't know. It was crazy. It was embarrassing. It was torturous. It was horrible. So, I mean, I've been taking it. I have to take it. You know, this is life and death for me. So, I am doing what my doctor says. And, you know, just, it has been better. But I'm just warning you, if you do try it, have someone with you for the first 24 to 48 hours. That's what I would suggest. The next one is the dronabinol. This is like a Marinol, like the dronabinoids in cannabis. This is like cannabis prescription, pretty much. So I don't really use that, but I guess it's there if I need it. Promethazine is my angel. I love promethazine. It's the only thing that works with the nausea. And if I need to do more, I can use my my liquid or my IV Zofran. Speaking of IV, here is the next kind of area. So, my doctor wants me to get rid of my catheter and just be on these other 18 or 15 meds or whatever. I don't know. It's crazy. So, I apologize. The video is kind of shaky. I'm still getting used to this medicine. So, I just thought it was important to let you guys know what happened. So, anyway, with my catheter, which is right here, if you can see, this is where it comes out of. So I have my catheter here. So what I use on my catheter is the Zofran IV, if I need it. The promethazine, which I definitely need. I take 50 milligrams, which is 2 of these 25 milligram vials every 12 hours. Just a little tip. If you can get your pharmacy to give you swab caps like this, it is awesome. It cleans the tip much better of your catheter, the lumen, and you can kind of just put that on while you're setting up all your other stuff. Then you need, I have Tygan. Tygan is an intramuscular injection, which I hate. But if I'm really sick or I'm out of my meds or whatever, then I have to do it. I have to do it. Of course, all the flushes here, they just go along with the business, you know. So I just kind of wanted to fill you in. It's scary being on so many medications. I suggest really researching them and kind of trying to know if there's any difference in you when you start a new medication or stop a medication. Because there are cases where people stop a medication and they get better.